I really hope you have the chance to learn more about this program. It is a senior-only program, and all of our teachers will be touching base on the prerequisites and all of the different material that will be covered in the courses. But before we get started in that, I do want to introduce a couple of DCTS administration, first being our director, Dr. Stephen Butz.
Hello, everybody, and thank you for joining our virtual open house of our medical careers program. This is the last one in this series. We may be looking at other avenues for future events during the rest of the winter and soon to be spring. So thank you all for joining us. We have all of our teachers on the Zoom meeting and several administrators. I want to thank our teachers for all the hard work that they have done this year, and with the beginning of our application process now, participating in this open house and our previous open houses about medical careers and the other tech areas that we offer. So thank you all, and let us begin.
Perfect, thank you so much. The next person I'd like to introduce is Dr. Dan Palmer, the principal at the Fallcroft campus.
Hello, everyone, good evening and welcome. It's great to see everyone. I'm sure you'll get a lot of great information tonight about our medical careers program, which is amazing. We wish you well. We hope to see you in the fall, and thanks for coming tonight.
Perfect, thank you so much. Next is our other principal at the Aston campus, Mr. Chris Hanson.
Good evening, everyone. Thanks so much for joining us. We look forward to your questions, and welcome. Thank you.
Thank you so much. I do want to mention another DCTS administrator, Dr. Linda Lomas, who is the supervisor of student services. Unfortunately, she could not join us tonight, but I do want to mention that DCTS does have support staff of English and math that we like to support your children as well with all sorts of different types of education and knowledge. But I now want to turn it over to Miss Sarah Connolly Smith, one of our medical careers teachers.
Good evening. My name is Sarah Connolly Smith. I am one of the medical careers teachers. I'm normally based out of Lankenau Hospital. This year I'm teaching from Marble Education Center, but hope to be back at Lankenau this fall. So on behalf of the medical careers teacher team, I would like to say thank you for joining us. We do plan to provide you with a lot of information about our medical careers program in the next 45 minutes or so. And we hope that we will not only inform you, but inspire you at the same time as we give you a firsthand glimpse into how our program offers so many opportunities to show you what the healthcare profession is all about. So just to reiterate, this program, Medical Careers, is for seniors only. So we are hoping this presentation is for juniors out there that are interested in a career in healthcare. If you are here and you are a freshman or a sophomore interested in a healthcare pathway, we do have other programs at DCTS that may interest you. I'll just mention a few. We have biomedical technology and lab sciences, health sciences, dental occupations, exercise therapy and sports science, and lastly, emergency and protective services. And certainly that can get you on the right track to perhaps be a medical career student as a senior. We are not going to be discussing those programs this evening, but feel free to reach out to us and we can get you in contact with the people who can give you more information about those programs. So again, Medical Careers is offered in a partnership with hospitals throughout Delaware County, and they are all listed here. The Mainline Health System with Bryn Mawr, Lankenau, and Riddle Hospital, Delaware County Memorial Hospital, Chester Crozier, and Mercy Fitzgerald and Taylor. The hospital that if you are accepted into the program, will be based at really depends on your school location and the proximity. Would you like to keep students close to their home schools just for transportation and ease for you to get back to your other classes? We do have 2 sessions a day, morning session from 7 to 9, and an afternoon session from 12 to 2. And this is Monday through Friday, every single day. Medical Careers meets every day. And it's always that time, even if it's a clinical day or a skills day or a theory day. It's always 7 to 9 or 12 to 2. The time that will work with your schedule and your school is a conversation you'd have to have with your guidance counselor. As this time of year, you're figuring out your senior schedule and how that all fits in the greater context of your school. Certainly reach out to your counselor to see which session might be available to you. We are privileged to teach students from many sending schools within Delaware County, and we think that is a great benefit to the medical career students, that they're able to network and meet so many other like-minded peers who are interested in healthcare careers throughout Delaware County. Our curriculum is divided into 3 main areas, and we'll talk about each of these. The first is academics, clinical rotations, and patient care skills. It is a lot of information that we cover throughout the year, a great deal of information, and this is why most schools offer honors level credit for medical careers. Specifically talking about the academics, well, what do we cover throughout our year? There is a lot of anatomy and physiology. And if you have already taken anatomy and physiology, or you're taking it now, or you plan to take it as a senior, that works beautifully with our curriculum as well. We are able to add on to what you're learning in anatomy and physiology by adding a pathophysiology piece, discussing the study of the physiological changes that happen in the body from disease, and build upon anatomy and physiology that you're already taking. If you haven't taken anatomy and physiology and you don't plan to, that's okay too. We start from the beginning, the structure of the body, and work forward. But we do get in a lot of pathophysiology, and a lot of our students really find that interesting. We discuss case studies and put a healthcare piece in addition to that. Medical abbreviations and medical terminology, we cover the entire year. We start with the medical abbreviations and we move on to medical terminology. The amount that you will learn as far as understanding medical jargon, any medical show you want to watch, drama, movie, you will be so impressed with the amount that you'll be able to understand after being a medical career student. And just to illustrate that even more, we not only ask you to learn these terms and these abbreviations, but there's so much more than that. To give you an example, PERRLA will ask you to memorize that stands for pupils equal, round, and reactive to light and accommodation. We'll ask you, yes, this is the abbreviation and this is what it stands for, but we'll go into so much more than that. We'll talk about that's an example of an assessment piece for neurological status or an eye exam. We'll watch a video of how that exam is performed. You receive a pen light in your patient care bag, We'll take out the pen light. We'll look at each other's pupils and see how they react to light. So it's more than just learning those abbreviations and terminology. We do offer many certifications along the way during our program. OSHA 10 is Occupational Safety and Health Administration. The 10 stands for, it's a 10-hour safety and health certification. This is good for 5 years. This is a great certification that will enable you something else to put on your resume. I had a student
jump in for a second. That
Please.
Certification is actually not for 5 years. It's actually good lifelong. So, which is amazing that these students can have it on their resume for as long as they continue in the healthcare field or take it with them to any other job or occupation, which is incredible.
Even better.
Absolutely.
But absolutely, that's something you can tell an employer that you have taken that course, and now that you know that it's good for years and years. American Heart Association provider training, you'll be certified in BLS CPR with the use of an AED, as well as first aid, and that's the actual provider training that healthcare professionals take every couple of years. So it's the same training that we get as professionals. And the NOCD is also something that you will be involved with throughout the year. This is career and tech educational standardized testing, and it has a skills component to it as well. We do also cover many health science topics, such as safety and infection control and law and ethics. Infection control has been a big unit this year, in particular with thinking about the immune response and vaccines. So that's very applicable to what's happening all around us right now. See, next slide, please, Rachel. We also talk about communication in healthcare and how that's so important between providers, between patients. We do a lot of different scenarios to help you become a better communicator, and that's so important as you're working a lot of hands-on piece with patients and coworkers as well. We prepare you for secondary education and careers in healthcare, and keeping that careers in healthcare in mind. We have a lot of students who are interested in many different aspects of healthcare, from therapists to nurses, pharmacy, lab, research, all the way to anesthesia, surgery. So our class really does prepare you for your academic career as well as your future career in healthcare. We will be talking about our guest speaker program a little bit later, but I just want to bring this up now that we have many medical professionals that come in and share their expertise, their clinical experience, their stories, their path in their career that's gotten them to where they are. And they're able to add a lot to our program as far as what we're covering. They're able to expand on it. And that's been a wonderful addition to our program. All right, and I'll turn that over to Mrs. Barakat.
Hi, I'm Ro Barakat, and I teach the program over at Crozer-Chester Medical Center and Marple, kind of split between both of them. But the reason that most students sign up for this program is for the clinical rotations. It seems to be the biggest draw. And unfortunately, because of COVID, we're not in the hospitals this year. But as Mrs. Connolly Smith had said, we hope to get in there next year. So when our students go to the hospital, they shadow in all the different departments. They are on med surg floors, intensive care units, the operating room, the emergency room, labor and delivery, if that hospital has one. They shadow entry level. They might be shadowing a PCT, a patient care technician, or they could be shadowing a physician. They're not usually one-to-one with a physician, but if they're in the operating room, they're observing the surgery being done. Some surgeons will say she can just stand there, he or she can stand in the corner. Others will say pull up a step stool, and we'll actually let them stand next to them and observe and like look right into the surgical field. So it all depends on the luck of the draw, I guess. They get to watch a lot of patient care procedures. They're in the, like I said, they're in the intensive care unit. If there's a bedside procedure going on, they'll see it. They'll see the procedures in the operating room, things going on in the emergency room. In the GI lab, they even get to go into the GI lab and see like colonoscopies and endoscopies, things like that. They interact with staff and patients. You know, it really helps them. It increases their comfort level when they get into either like nursing programs or, you know, they're going into medicine or PA or PT, you know, because they increase that comfort level. I have a lot of students when they go away to college and they write back to me and they just say, this is so much easier because of the time that I spent in clinical, or that I already know all the jargon. I already know all the terminology and the abbreviations. I know how to do vital signs. So it really makes me feel good when I get texts and messages like that. So the shadowing experience is primarily observational, and they go to clinical 2 days a week. So not initially, not right out of the gate. From September till right after Thanksgiving, we are in the classroom 5 days a week, because you have to learn how to protect yourself. You know, you have to learn how to put your PPE on and take it off without contaminating yourself. You have to know what to do in the event of a fire alarm going off. You know, they have to know how to use a fire extinguisher. Not that they're going to be the ones using it, but if the state is walking around and they ask you how to use it, you probably all learned it too. Race, rescue, alarm, confine, extinguish. So that's our clinical. We started in, like I said, the end of November, and everybody's got different clinical days. And I've changed them over the years. Sometimes there's staff meetings going on every Tuesday, so I change my clinical day. When the students go to clinical, they are responsible to write a journal. And I usually ask, well, I always ask for 1 page. Tell me what you learned while you were in clinical. And I have to say, most times I get 2 pages. Sometimes I've had 3 and 4 pages of things that the students have learned. So for a high school student to write a journal that says, I shadowed Mary in the intensive care unit, and she hung 2 units of blood because the patient's hemoglobin was 6.2. Well, that's amazing that a high school student even knows that. So, so that's our clinical. Can I have the next slide, Rachel? Thanks. And these are just some of the areas that they shadow in. All the nursing units, and I said this before, ORE, pharmacy. I forgot pharmacy. I have students who are in pharmacy school now, or they are pharmacists. And when they're leaning towards that, some of them like the excitement of going to all the floors and OR, and some of them are like, what, I can't deal it. And that's fine. we will work with you on that. Some people aren't comfortable in the clinical setting. So we'll just give them more days in the pharmacy, or days that are not in the OR. Because not everybody is meant for that. So ICU, radiology, they'll go and see this is how an ultrasound is done, or a CAT scan. They go to lab, they see what happens to that blood when they draw it from my arm. Is it going to hematology or chemistry? Is it going to blood bank? So they get to go into the lab as well. They'll go into the pathology lab to see tissue that has been biopsied. You can take the next slide. Still more areas, respiratory therapy. And a lot of these, I know we talked about guest speakers a little bit, but we'll have people, about a month ago, we had a respiratory therapist come. Most of the students didn't know what a respiratory therapist did or what the schooling was like. So it's really great that they can shadow these people and find out, because not everybody, I think a lot of people think if you work in a hospital, you're either a doctor or a nurse. And there's so many other disciplines, so many other allied health fields. So cardiac cath lab, my students have gone into the cardiac cath lab and they've seen patients who are actively infarcting, having a heart attack, go on that table and the doctor will aspirate a clot out of one of their coronary arteries and their pain is relieved. It's really pretty amazing. OB and pediatrics, not all of the hospitals have that. But, if you go to a hospital and you're like, I really want to be an OB nurse or a pediatric nurse, then we can do mock clinicals and things like that. And sometimes we have flip-flopped a day or 2 for clinical, just to give you that experience. Okay, you can give me the next slide. You know what, I'm sorry, is this me or is this Laura?
I think that's me, Ro.
All right, sorry,
Yeah.
Thanks.
No, so I'm up. Good evening, I'm Laura Wolhoff. I am one of the medical careers instructors assigned to Riddle Hospital. And as Ro and Sarah both mentioned briefly, we spend a lot of time on patient care skills. I think it is a very exciting component of our program. Whether or not we're out in that clinical rotation, we are doing some pretty serious patient care skills within the classroom. I remember being a new nursing student, I couldn't wait to take somebody's blood pressure. So all of our students are very excited to learn these skills. We provide a skills bag to every student. They'll have their own stethoscope, blood pressure cuff, as Sarah mentioned, a pen light and some other first aid equipment. We'll spend a lot of time learning the fundamentals, how to take the blood pressure. We'll talk about what it means. Blood pressures that are high, that are low, what are the implications to our patients? We'll talk about patient transporting and transfers, looking at the list there, infection control, which is more important than ever. I know that both the ladies referred to how to put on PPE, which is our personal protective equipment, and how to take it off. We'll all have our own set. We'll practice that several times and we'll get really good at it. We'll learn about patient assessment, a very thorough assessment, and proper documentation. And then as Sarah had mentioned earlier too, we will become first aid and CPR certified. Next slide, Rachel. I think there's some pictures here. So as you can see, our students are having a lot of fun. Even in the classroom, we all have sim mannequins that simulate real world scenarios. Maybe we'll have a patient whose blood pressure is plummeting and we're counting on you to get that blood pressure, taking pulses, and again, thinking about what are the implications and what are our next steps. So we have a lot of fun practicing on each other, and even encourage you to go home and practice with your family and friends at home too. And there's some more height and weight, again, drawing up medications. We'll do a lot of those skills within the program. Next slide. And most of the students that come to us, they are interested in a variety of medical career fields, from nursing to doctors, but beyond that, physical and occupational therapy, speech therapies, pharmacy, and you can see their med tech physician assistants. We even have a lot of students that are interested in dentistry, maybe even medical research. So the opportunities are endless, and we really do encourage you, if you have any interest in pursuing some sort of field of medicine, that you consider our program. Back to you, Ro.
Sorry, I muted myself. So we boast 100% college placement. 100% of our students are going to go on to post-secondary programs. Most of them attend four-year schools. Whoop. Thanks. Most of them attend four-year schools, but I've had a few go to Delaware County. I'm a Delaware County alum before I transferred to Westchester to get my BSN. So we help the students with that search, because sometimes they don't know what schools have a 5-year PA program versus a 6-year, or medical programs that are kind of collected together. So graduates are tracked through surveys, emails, social media, Facebook, things like that. It's a great way to stay in touch. Students like to tell you, where they are, where they got a job, what they're learning. It's just a great way to hear how successful they are. So many are working in the healthcare industry as RNs, PAs, MDs, pharmacists, PT, OT, rad tech, respiratory therapists. There's others too that aren't included in here. And then Hosa. Hosa is a student-led organization, just like you would have in your home schools, like FBLA, the Future Business Leaders. Hosa stands for Health Occupation Students of America. It's actually not called that anymore. They changed the name, but we still call it Hosa. So does the Hosa organization itself. But there's community service and volunteer opportunities. I know for me at Crozier, our students would help with the blood drive. We would go around and try to get workers to donate blood for the annual blood drive. It's actually semi-annual. There is also a National Technical Honor Society, and just like you have the Honor Society in your home schools, we have one as well. The criteria is 95 and above in not only your medical careers program, but in your home classes as well. Graduates return as guest speakers. I just had one of my former students is an OBGYN at Brigham and Women's in Boston, and she came last week as a guest speaker. But a lot of them have come back. They love the program, and they love to share their success. So students hired in entry-level positions while in college. A lot of times, Taylor Hospital was hiring students as we call them PCAs now, patient care assistants. You don't really hear the term CNA anymore, the certified nursing assistant, but they were hiring them. It does give you a leg up when you get into college. If you're in nursing school or you're in another program, if you could work as a CNA and get that experience, even more prepared, even better prepared. And I think the next slide is somebody else. Oh, that's you.
That will be me. Hello again, everyone. I want to talk about a couple of programs that we offer at DCTS for not only just medical careers, but all of our students, which is a great opportunity. This one specifically is for our medical careers with everything that's listed. We offer dual enrollment programs with Immaculata University and Widener University. These are classes that are happening simultaneously as they do the medical careers program. They are online programs where the students will follow a syllabus that the professor will give them. Those are the class offerings that we had this past year. We do follow the colleges in what course offerings we offer this year and for next year even. So these classes might be different for the following year for 2021, 2022. But we are continuing our partnerships with these colleges and always looking for more opportunities. These credits that you see right here are transferable and they're heavily discounted. Immaculata University is $300 for one course, and Widener University is $200 for a course. So these courses are very much discounted. For Widener University, students can earn as many college credits as they can obtain. So they can, as much as they can put on their plate, they are more than welcome to, which is super exciting. It's a lot of general education courses. And like I said, these credits are transferable, so they can be taken to another university if they decide to go somewhere else. But again, these are discounted, and it's a great way to start looking at colleges and start getting into the rhythm of doing the college courses and seeing which pathway, if you like the school itself and the way that the classes are run, it's a good way to kind of get that head start. It's also a good way to start getting ahead on college classes in general, because you'll now be ahead of other classmates with the classes that you already have. So you have the potential to maybe graduate early, or if you want to pick up another major, minor, or certificate. There are so many different options that you can do with the dual enrollment program, and it's completely up to you. You can take one class, or you can take 3, or you can take up to 5 classes in a semester. As you can see, these are broken down that there's no more than 3 classes per one semester. So it's definitely not an overload, but make sure you are talking with your parents and your counselors that taking all of these classes on top of your coursework at your high school, as well as the coursework in the medical careers program, is a good fit and that you're not overloading yourself. Another opportunity that we have, are articulation agreements. These are local agreements that DCTS has with one other university. So the universities that we work with are Newman University, Pittsburgh Technical College, the University of Sciences in Philadelphia, and St. Francis University. So for example of how these work, I put an example at the bottom. Our students must complete the task list, NOCD, and CPR and AED. If a student completes that, they could go to Newman University for the equivalency of those 6 credits right there for the 2 programs, which is awesome because again, you're getting ahead in your program and you have the ability to take additional classes, graduate early, do another major, minor, certificate, anything that you're interested in. But keep in mind that this is also going to be off of tuition, off of books, housing, meal plans, and any student activity fees. So it's a good way to take credits with you for completing the programs at DCTS. And now I believe I'm passing it over to Jamie to talk about the guest speaker program.
Hello, everybody. My name is Jamie D'Amico, and I am normally I will be based out of the Taylor Hospital location. Right now I am teaching out of the Aston campus. Sarah had mentioned, she started briefly talking about the guest speaker program, but I just want to go into a little more detail. So we have always had the guest speaker program, and it's been a great resource for the kids aside from our normal information. However, normally without COVID, they would come into the classroom and maybe do a little more hands-on. We had a PA from Lankenau last year or the year before, and he actually came in and showed the students how to actually do sutures for surgery to close up different openings of the skin. So they did get some hands-on with that. But now with COVID, unfortunately, we're not having them come into school. However, that we've kind of benefited from that because now we're able to get many more speakers involved. So our kids this year have been able to get such a wide variety of speakers, from people that work in admissions in the healthcare system to we just had Chester County's Department of Health. And as you can imagine, at a time that we're in right now, it was even some of the, so I could speak for all the teachers, we were learning things from her. So it was a great benefit to the program. But it's just a really nice way to, maybe a student is in between two different careers, and to have that, even though we are all nurses, we have not necessarily, we have a good variety of us have different backgrounds, which is nice. But again, we have not hit all of those areas. So it's really nice to get somebody that either currently works in the field or that has worked in the field, that has that real life experience, because it just engages the kids a little bit differently when they can actually show them real live footage. We have videos of different surgeries. We just had a neurosurgeon, and he actually had clips of surgery. So that was really nice. Some kids think they want to get into surgery. They see that and they say, oh, surgery's not for me. And to be able to see that now in high school is great, instead of 6 years down the road going to school and then realizing it's not for you. You can go to the next slide. So this is the picture that the PA we had. He did the sutures with all the students. Some more pictures. But overall, about the guest speaker program, another thing that's really nice is these guest speakers, obviously they have a busy, most of them are still currently working in the field, depending on what department they're in. And they've bent over backwards for these kids and completely have made accommodations to see both AM and PM classes, and they even extend their information. They give them their email and they give them all their contact information, that if they have any more questions, if they want to follow up with them outside of the program for career choices or different avenues and pathways for their career choice. So it's been, it's all about who you know, and it's just a really great resource outside of benefiting the program. All righty, and I'm turning it over.
Yep, I think it's me now. So I guess the next slide. I'm Celeste Quigley. I typically teach out of Delaware County Hospital. This year I am at the Fallcroft campus though. This is just an example of a lot of times the hospitals will ask our students to be the volunteers for their disaster drills for their ER. So this could be, they'll have something, a mock, I think the last one was, I think it was some kind of a gas leak in a building. So the students all had little slips of paper that said what was wrong with them. So the staff of the ER knew, well, this person's having respiratory problems, or this person needs an eye wash, or they've been contaminated, so they need to go to a separate area of the ER and get taken care of. So the students really enjoyed that. And what else? I guess our next slide then too. This is still more of them getting ready for their disaster drill, the students, and here's the staff kind of giving them what their issue was going to be when they were presenting into the ER. And I mean, they were put on stretchers. Some of them were taken out of ambulances, put on stretchers, wheeled into the emergency department. And they really had a lot of fun with it. Some of them really kind of, their personalities really came out. They did a little bit of acting. It was great. Next slide. This is, I think at Crozier, they'll be able to attend the staff's grand rounds. They do that at Crozier Chester campus, where they will get together with the doctors and they will, the doctors will talk about certain cases that have happened. You know, maybe there was a bad outcome, a good outcome, what could have been different. And the students are hearing this. They're hearing the doctors talk amongst themselves about how to better take care of patients. So that's great too. Next slide is more Hosa. So as Ms. Barraquette was talking about, this is that student organization. This is at their state conference. And a lot of people remark at how like they have to wear a suit. They look very professional. They compete in anything from medical terminology to like a Hosa Bowl, where they're competing with as a team against other students from other schools. They really have a lot of fun with this. And then they do, I think this year it's in Valley Forge, is that correct? And then the state, that's the state one. And then the national one, they're still hoping it'll be in person, but it's been in Orlando, it's been in Texas. Where is it? Texas this year? I don't remember.
I'm not sure if it's Dallas or if it's
Okay.
Disney Anaheim.
Yeah, it's
Okay.
in Orlando this year.
Oh, it's
Okay.
Orlando.
So again, you know, this is all going to be determined regarding this pandemic. So we shall see. As we mentioned, we also have the National Honor Society that they get to participate in. What was the average? That has to be, what is it, 95 or higher? And then they really kind of stress attendance. So they can only have one absence in the quarter. They'll meet a lot of new people. I've had students who they've met in school, in med careers. They didn't go to the same high school, and they've become college roommates. So it's really kind of nice. They all stay in touch with each other through social media. I think am I turning this over to Laura now again?
It's fine, I can jump in. As Celeste did say, I think definitely a benefit of joining our program is the students have commented how they have made lifelong friendships, as Celeste said, just by meeting different students from other sending schools, even being in the hospitals and some of those clinical rotations. And then as Jamie had mentioned, forming even some relationships with the guest speakers that we've had. And so right here on the screen is just where the students have an opportunity to reflect on the year and the things that they've learned and the things that they've, really have gotten out of being in the program. Of course, one of the biggest highlights is the clinical rotations, which we absolutely are hoping to get back into. But despite that, just being in the classroom, like I said, the patient skills and the sim labs and the scenarios and all of the things that you will learn in those friendships, students have really walked away with some great experiences and have realized that, a medical career is their destiny, where they want to go.
I think this is back to me again. So we're hoping to have your applications in by February 26th. Your guidance counselor will have these applications available to you, or they are also on our website. There's a DCTS application, and then there is a supplemental medical careers application that we ask for as well, just because we need to see what kind of sciences that you've had. There is an essay and again, interview, depending on where we are in our world these days, whether there'll be an interview. I mean, potentially it could be Zoom or over the phone. So areas that we do look at is your GPA, and we do require that you have a GPA of 3.0 or higher. And we also need to see that you've taken biology and chemistry and that you've gotten a B or better in these. It is a prerequisite. So if you haven't taken bio or chem yet, see if you could work it into your schedule, or both of them yet. And, sometimes we do make exceptions if you're going to be taking it your first semester senior year, but we'd like for you to really have that under your belt before, joining this course. We will look for your rank. like we said before, it's really important for you to be in class. You can miss so much if you're absent. So if you have some issues and you've been absent a lot, that could hurt you when we're going through our admission process. If it was because of like an incident where you had an injury or a surgery, we'll definitely take that into consideration. Another big issue is disciplinary history. This is more of the hospitals. They really want you to have not have any kind of disciplinary actions against you, because like we said before, when you're going to your clinicals, you're kind of out there in these areas by yourself. Yes, we're walking around and checking on you, but if you're up in the operating room, we can't just walk in and check on you. Or if you're in the GI suite watching a procedure, or if you're in CAT scan. So we, need to make sure that you are, okay enough to be left on your own. We do look at extracurricular activities, and we look at the essay and the interview. So as we said, apply mid-February. So we want the applications due by the 26th of your junior year. And again, we'll be figuring out interviews. We might even have this deadline a little earlier than June. We're hoping to, just because of all of your scheduling that's going on. Your counselors have a lot to do, especially fitting this into your class, into your schedule rather. And you can definitely talk to your counselors, because they will tell you which session is best for their schools, or for your individual school. Okay. I guess the next one is, okay, this is also when you were in the hospital, we need to have a criminal background check and a child abuse clearance. You have to have your physical examination. We have to make sure that you've had some of your immunizations, so proof of your vaccinations, and we do require a TB test and a flu shot also. And you will get a huge packet in the summer of lots of forms. A lot of this will be in there. There's a letter, it kind of explains everything. And there'll also be a letter about what the dress code is. It's a polo shirt and khakis and sneakers. Just because we don't like them to wear scrubs. We don't want them to get confused with one of the healthcare workers, and someone, asks them to do something that they're absolutely you're not qualified to do. And, we don't want to put you into that awkward situation. So again, here is our website, and you can find the application on there. And I don't know, is that it for ours? Yeah, so any questions? We have Mrs. Barrakett's email here, but if you want to reach out to any of us, that's fine as well. And these are just some pictures of the students doing skills, wearing their PPE. Kind of some of these are repeats, learning how to draw medication up from a vial into a syringe. So they get a lot of experience. So it's a lot of fun. I guess that's it.
Thank you so much to all of the teachers and all of our staff for participating. We are going to open the floor for questions. If you do have any questions, please feel free to drop them in the chat box as well as the Q&A. So I'm just going to read some questions, and for all of the medical careers teachers and all of the DCTS staff, feel free to jump in when you have an answer. So our first question are, what are the requirements to apply to this program? What do my grades need to look like? I think we just went over a little bit of that, but if anyone would like to take the first question.
So about the requirements, oh, go ahead, Ro.
No, I was going to say, Mrs. Quigley did just go over them. So I don't know if that question was written before, but yeah, you should have the prereqs, the 2 sciences, bio and chem, should have a B or better in those. And as far as like discipline, the hospital asks us to have students who are in good standing. So that's why we have to ask for the B or better, the 3.0 or better, no discipline record. So it's a contract that we have with the hospital. So if you want me to elaborate on something else, you can just feel free to put that in the chat. But I think it was probably written before Mrs. Quigley.
I believe so. Our next question, what does the homework look like?
It's a lot of work, I'm not gonna lie to you. There's a lot, especially when, we're in the clinical setting, you are writing journals, but it's manageable. I've never had a student say that they're swamped and they just can't do it. It's very manageable, but you are gonna work, you're gonna write. I do tell my students I'm not an English teacher, but you will be better writers when you leave. We kind of are sticklers for good writing skills. That's important too. It's not just the clinical piece. All of it is important.
Fantastic. I actually have two questions that are very similar. What was the site to apply again, and where can we find the application for this program? The application for the DCTS application, as well as the medical careers application, can be found on dciu.org/DCTS. And I am going to pull up that screen again that has, oh, there it is. At the very bottom of this screen, you can find the website dciu.org/DCTS. It will have all of the information for the application, how to apply, but make sure you're also talking with your counselor about the application and applying as well. I believe Sarah answered this question earlier in the beginning of the presentation, but where did it go? Which school or which hospital will you attend? Do you have a choice?
I mean, that kind of, that depends on where you're coming from, your sending school. I mean, if there are, we do try to accommodate as much as we can, but I don't know. What else could we say about that? Like geographically, we try to do it geographically.
We ask students if they have a preference, but we can't promise it, because if their whole school, let's say, I don't know, let's say you're a Haverford student and your whole school is going to Bryn Mawr or Lankenau, and you say, but my mom works at Crozier, Haverford's probably not going to bus you to Crozier. Like, they're limited as to how far they can bus. So that's why we look at geography. We try to keep you as local as possible.
Fantastic. Our next question is, what levels of chemistry and biology do we need?
Some have had honors. You don't have to have had honors, but you will score higher in we have a rubric that we follow. But basic is, I mean, depends on what your grade is. That's what we're really looking at. So.
Fantastic. This is another question. Will a student not having an updated flu shot jeopardize their chances of getting into this program?
No. I mean, we usually require that you get your flu shot by November of that year. So it'll be November of 2021. So that's fine.
Yeah.
And in terms of the COVID-19 vaccines, anything like that, there hasn't been any decision on that. Hospital settings and medical settings are still working through their procedures, policies. As we get a little closer to the restart of next school year, we'll be looking at that. That's likely going to be, we're to be working off of whatever requirements are the hospital settings have. And as of right now, they have not gone down the avenue of requiring it just because of unavailabilities yet. So we'll see what happens. You'll have to stay tuned on that. There was another question about the possibilities of us being virtual next year. My crystal ball isn't working all that great right now. However, we are back in person, have been since October for all of our tech programs. We do have a virtual option right now for our tech programs, but I do anticipate that as we head toward next school year, we will be returning to a entirely in-person environment, including back in the hospital settings. Now, of course, as this virus has changed, the circumstances have changed considerably. Our updated guidance will change, but as of right now, we're looking forward to the fall and returning back to our hospital settings for medical careers.
Thank you so much. Our next question is, are the 3 portions, academics, clinical, and patient care, simultaneous or consecutive?
They're simultaneous. They're going on all the time. Mhm.
Fantastic. Are you looking at our overall grade for biology and chemistry? If it is not above a B, will you not accept us?
We're looking at everything. I mean, your grade is just a component. It's just a piece of this whole admission process. So if you're like, oh, I got to C, maybe you shine in other areas too. Like it's, if you got a D or you failed like one of your sciences, then that's one thing. But yeah, I wouldn't let that stop you if you had a C, because we look at the whole picture.
And I would urge everybody to apply and leave us go through the application process. And if medical careers doesn't work out in terms of being accepted into that, we do have other programs that could meet your needs and get you a head start on whatever career pathway, college pathway career that you want to enter into. So by all means, I would urge you to apply. And then if it doesn't work out, there are some very good programs that we offer in similar areas to medical careers.
Fantastic. There is a question. Is there a way to access any of this information at a later date? This Zoom presentation is being recorded and will be put on our website by tomorrow morning. There is also the previous medical careers presentation that you're more than welcome to watch as well. Both presentations have had similar and different questions, so there's definitely lots of information to go around. And you can find more information on our website as well, but you will be able to access this information in this presentation by tomorrow. Let's see. Another question, do you issue a transcript separate from a high school or college admissions purposes? I believe one of the principals can help us out with this question.
I guess if I'm understanding the question correctly, I think it would depend depending on where you would go, what college you would go to. If it's a college that we already have an agreement with, we wouldn't need to. But if it's a college that you're trying to see credit recovery from in terms of transferring credits, then yeah, we might have to.
We issue grades, and then your sending school will then obviously issue the grade on their report card and obviously issue the weight that it is determined by the district. So you'll get it on your sending school's transcript as well.
Fantastic. I am very interested in this program, but what if I sign up for the program and when senior year comes, I do not want to participate in this program anymore?
In that case, usually a SWAT team shows up at your house. No, I think, to be honest with you, the program, it's a very popular program. So I think, if you changed your mind, that's understandable. I mean, we would just hope that you would give us a little bit of notice so we could offer up that seat to another student that would have applied. But again, I think that you will not regret the decision to join this program. These instructors that are the people who make this program. This program is just so impressive, and you will learn so much. And your confidence level in terms of your understanding of the medical field will grow exponentially.
Thank you so much. Another question, how many schools participate in this program or are allowed to apply? We work with all the schools in Delaware County, all of the public schools and private schools as well. Hopefully that will help, but talk with your guidance counselor about your application and the process to get accepted into medical careers and about your future careers as well. It's definitely a great thing to talk with your guidance counselors and have someone being able to help you guide you on your pathway to a future career. Let's see. I guess this is going to be around our last question since we're almost out of time. For the honors technology program, could you repeat what the requirements are again? Do we need a 95 in all of our classes at our home school and the medical careers?
Yes, and you can have 1 absence per quarter.
And some of the requirements are listed on the screen right here, but I'll also go back to the previous page that has other requirements as well. But as we're about to wrap up, I do want to say thank you again to all of our teachers and everyone who is in attendance tonight. Before we close the presentation for the evening, do any of the medical careers teachers or any of the DCTS staff have any final comments that they would like to add?
One thing I just want to say, I know there's people are asking about how many are accepted. So we take 168 students. So we have 7 locations and 12 per location, well, 24, split up 12 and 12 for AM, PM. So, there are a lot of spots. And then to also piggyback on to, if you just decide to change your mind, we do put people on the waiting list. So if you do decide to change your mind, definitely let us know right away so we can offer that spot to somebody else, so we can get all the mailing out to them and they can get all their clearances and everything. So that's just one thing I just wanted to mention. Yeah.
So
Oh, go ahead, sorry.
I would just chime in. A lot of questions, good questions by students. You can follow up with us through email. You can speak with your high school counselor. We have regular contact with the high schools around our programs, and they can, if they do not have the answer to your question, they can definitely contact us and get the answer. The key thing in our application process is to put your best foot forward, put your best information forward, give us the information, and give it your best shot in terms of applying. And if you're interested in medical careers, interested in something in the health occupations areas, we have multiple pathways that you can get through. And being a junior in high school and making a final decision, I don't think any of us around the table, around the Zoom meeting, definitely had a final decision. I can guarantee I didn't. As a junior in high school, I was thinking going into medical careers, and then I got sick and injured and fainted at the sight of blood. So obviously that was not a good career pathway for me. And things change. So the key thing right now is to sort through, begin thinking about what you want to do for your senior year, and hopefully our technical programs are an area that you want to consider. Medical careers, speak with your guidance counselor, speak to friends, speak to our teachers, contact us to get more information. Our website has a lot of information on, and you can review our open houses for the other programs. Also, our health science open house was done a couple weeks ago also, so that provides some good information. So unless another staff person has a comment, we are to bring this to a close. There will be other opportunities for us to engage and have dialogue, and you can definitely have contact with our guidance counselors, our school counselors, and also your own. Thank you all for your participation. Thank you to our teachers. Thank you to our staff who have helped out with these open house. And I wish you all a good night and a good rest of the winter, and hopefully spring comes fairly quickly. Thank you. Have a good night.
Thank you.
Thank
Everyone.
you.